There's lots of frustration in recent days about the number of people that have been gathering in parks and letting their children play in city playgrounds, despite the fact that the mayor has spoken up and said not to do so, along with city officials. And so today, those very officials have taken some dramatic steps to make sure it doesn't happen again. The mayor announcing the closure of all parks and park facilities, including off-leash dog parks, basketball and tennis courts, playgrounds and fitness equipment, sports fields, picnic areas, and skate parks. It's being done on the recommendation of the medical officer of health after seeing the number of people congregating in these spaces.
This decision was not made lightly. It was a very difficult decision, but it is the right decision. And it comes after we tried for several days to find ways for people to still enjoy our playground and other park amenities while maintaining appropriate distance from each other. Like other cities in Ontario, it has become clear the best way to protect people is to close.
At what point does the enforcement get stepped up beyond just city staff to the police, and what would it take for that to happen?
Thanks, Mark. So there's an enforcement process that's in place. The complaints come in, as we've explained, into 311. They're received, they're forwarded and processed and reviewed within the Emergency Operations Centre. That review includes review with Toronto Public Health and other city agencies, and the appropriate enforcement action is taken, which includes police.
Dr. Eileen Davila, the city's medical officer of health, noted there is now a total of 319 confirmed COVID-19 cases in Toronto. That is up by 39, with 22 people hospitalized and 3 new deaths. Those numbers are going up based on the lapse in not knowing if you have the virus or not.
You can be infected with COVID-19 and not know about it. For most people, it takes about 5 or 6 days before they show symptoms. For some people, it can take up to 14 days. Then there can be a number of days from the time you show symptoms to when you get tested and when you actually receive your test result. So what this means is that the positive test results that we're getting now are the result of infections that actually happened several days ago.
Meanwhile, word today that 3 workers at one of the Eglinton Crosstown construction sites have tested positive for COVID-19. 2 are presumptive cases waiting for confirmation. The employees and those that were working with them will not be at work for 14 days. Metrolink says they're monitoring the situation closely.
What we have is a responsibility from Metrolinx, because these are our projects, that they be maintained safely, and if they can't maintain a safe work site, then they can't continue.
Should construction on the Eglinton Crosstown be going on right now?
At this moment in time, that they are maintaining construction sites open as long as we can maintain safety.
The consortium building the project offered this, quote, Crosslinks is taking to Toronto Public Health and following their recommendations, we are notifying all the people who may have been in contact with the workers and providing them with the information on what they need to do based on the advice from Toronto Public Health. Chief Pegg also noting that frontline essential services, he says that they are actually moving at the proper pace. However, he confirmed today 5% of those essential workers are now in self-isolation.